that we should not just minimize mortality, maternal mortality, that in United States, I don't know what will happen for every we lose our life. It's getting very uncommon. But in this side of the world, you hear that somebody go to deliver and the person couldn't come out. You hear that somebody delivered, the baby come out, or the baby having some issues or other. I will use the opportunity to unveil to you the journey you are and what you are to meet, as well as even the gift of God that maketh rich and add no sorrow to it, which is children. What you are carrying in your tummy is supposed to be a blessing to you, and so shall it be. Amen. Nevertheless, he said, an effectual door, very beautiful door has been opened unto you, but there are many adversaries. There are factors that can cause. The thing I give you as a license in this commission is that you are permitted to know. If I ask you to do something or take something or that and that, you are permitted to ask questions. You know, the genesis of the crisis you see in healthcare, you see people drinking all manner of nonsense they think they can do for their health. You see some people binding witches and wizards over things that are happening to them. Some believe that it's one witch or one wizard. It's not them that caused the problem, neither the society even. The problem originated from doctors. I'm talking now about my own profession. You originated from doctors in the sense that our fathers of medicine started medical profession as a fraternity. Fraternity not of evil origin, but for monopoly's sake. If you look at the studies of different profession people studied, you find out that the language comes in the natural language of, if it's English, if it's French, you understand it. But the fathers of medicine sat down years back. Every English word that's supposed to communicate freely to people, they coded it. So, if you have malaria, instead of a doctor telling you plainly, you have malaria, that one way mosquito come bite you, you can't enter inside their body, he will tell you you have plasmodiasis. And he will write a prescription. Instead of telling you, take this drug 1-2 times a day for this number of days, he will write it. The drug is abbreviated, and then he will write it 2 BD times 7 over this, 1 over this. He moved from English to shorthand, from shorthand to mathematics. So it goes to me. As a matter of fact, it was some time ago a practice some crazy people do, whereby if they give you a prescription, they remove the label. You are not permitted even to know the name of the drugs. You know the implication of that? That is the reason why most times a doctor will prescribe drug and say take for 10 days. Hardly do people complete the dosage. Because doctor knows that you taking this drug for a period of 10 days, the sickness will definitely relapse before 10 days. But the fellow will take it the first day, second day, no difference. He will drop it. And that's why some now moving up and down, demon is somebody after me and all those kind of a thing. And if you look at the dictionary, the longest word in dictionary is a disease. How many of us know? A 45-letter words is a disease. It's called pneumono-ultramicroscopic siliconiovolcanosis. My brother, may that be your sickness. If they tell you now, even if they write prescription I give you, drop and buy coffee. Because you would think that your days have been numbered. One occasion they were talking about onchocercia, that's onchocerciasis. It's a sickness. Onchocercia caused by onchocercia volvulus. It's a vector, just like mosquito will bite somebody. It's in riverine area. If that thing bites you, it will inject that very onchocercia volvulus, lower. So you will now have a swelling in the eyes. But the drug treatment for that is just one tablet. Just one tablet, the swelling will go down. But despite that, check out the big name that is attached to it. Onchocerciasis. You say, am I having a psychiatric problem? This kind of a thing. So, the beauty of you being here is that you are permitted to know. But you knowing, you ask questions politely. You know, there are some crazy things I see in the United States among some blacks. If you have a lot of whites, they don't behave differently. You know, all these people, they say, it's my right, it's my right. You see some people talk like that. No. In this very aspect, you don't try to prove whether it's my right to know. Your right is to go to medical school, pass the exam, and become a medical doctor. But relationship can make all the difference. Even if a mad person, somebody is difficult, he still have friends, two of us. All depend on the manner of what? Approach. Okay? So when you relate with your doctor, it's not that trying, no, you're supposed to, I'm supposed to. No. I don't understand this. Can you put me through? This thing that is, how do you think I should take it? It's just a better way to present them. Do you understand? Okay. Now, we're going to look at the journey you are. And interestingly, you've been on the first 28 days, 28 weeks of the pregnancy. I guess everybody within that except you, perhaps. Eh? Okay, 28 this week, which means, okay. Who is 36? It's tomorrow. Don't miss tomorrow because I won't talk much about. Tomorrow is a very, very important day for anybody above because event that happened that time is actually what defines your pregnancy. But see, when it has to do with you getting pregnant, very unfortunate that in this side of the world, people just get married. The next one, I don't get belly. You do the work. It doesn't work like that. Are you with me? It does not always work like that. One key thing you should understand, apart from now that this has already been engaged, that's what is called pre-pregnancy counseling. Pre-what? Pregnancy counseling. This pre-pregnancy counseling is very important because it would try to look at a number of medical conditions of this very woman getting into pregnancy. What are the previous experiences of this woman when it has to do with a pregnancy and all those things? Taking, for instance, a woman who has suffered miscarriage before. You know, miscarriage is a very traumatic situation, true of us. If you have met people that actually suffer that over and over again, it's like getting to another one, you'll even be afraid whether what happened before will repeat itself again. So it's usually a trauma. So you have a period of counseling. Okay, I want to get pregnant now. What are the things that actually I could do or avoid or do this way to achieve that? If this woman is diabetic, listen to me. A diabetic patient, woman, ought not to get pregnant like any other person. Because diabetes is associated with some level of congenital abnormalities. Congenital abnormalities, they call it neural tooth defects. You can see some of the babies that will have one swelling at the back as if it didn't close well. We call spinal bifida, or the one that the head will swell off like this. So some organ abnormality can happen following a person who is already diabetic before pregnancy. Are you with me? Yes. So in the actual evidence-based guideline, this very fellow supposed to at least for 3 good months be followed up to do what is called pre-pregnancy counseling and treatment with folic acid. And this folic acid is not this conventional one they give you, take 1 high dose folic acid up to 4 milligram to enable this woman prepare against that abnormality of neural defect. And also, that woman should be prepared that even when she gets pregnant, around 10 to 13 weeks, that such woman should be able to do what is called prenatal monitoring in terms of, there are investigations, they do a blood test that is called 5-alpha protein or fetal protein. You will be able to get that very thing done. You can also do the beta HCG to show there's no abnormality, or what is called estradiol. That's one of they call it triple test. If you put what they call inhibin A, it makes it about 4 tests that such people can do. If there be an abnormally high one, you can be able to know this very baby inside this womb is coming out abnormal, or something you can be in position to do an intervention. For those that also above certain age, like after the age of 40, pregnancy after the age of 40 is associated with all this chromosomal abnormality of Down syndrome. You know Down syndrome? Yes. Down syndrome, Turner syndrome. When the woman is already above 40, at that point, it is something also that a monitoring can do, a scan of that very baby at that early stage. You look at this, their head, the neck. If the neck is wider, it becomes suspicious and all that. So the essence is pre-pregnancy counseling is what? Very important. What kind of drug is this woman using? There are drugs that are contrary indicated in pregnancy. Are you with me? There are drugs you can be taking. It can deform the bone of your baby. It can deform the teeth. You know all those babies you see, they will born and their teeth will be like wear sheet. Wear this foul sheet. People call it ezokoko. It's something like the black patches on the teeth. Have you seen such a people? Yes, those babies are there. It's one of the effect of tetracycline on a baby during if the mother takes it during delivery, during pregnancy. So for that reason, it becomes expedient that even the drugs you are taking, don't hide any drug. You are taking retroviral drugs. Make your doctor to understand, I'm on this particular drug. They will now look at the ones that are compatible with pregnancy, compatible with the baby in your womb and all that. Are you with me?
Yes, sir.
Very, very important. Now, we go a little further. We are talking about pre-pregnancy. That's it. Pregnancy have not been, you're planning it. We go a little further. Power. Okay. You can hear me?
Yes.
All right, thank you. So, going a little further, we look at the aspect that has to do with hypertension. But listen to me. Hypertension in pregnancy is of different types. You have hypertension that this person is a hypertensive woman before going into pregnancy. Are you with me? And you now have another one that is called pregnancy-induced hypertension. But this is to say, this woman was never hypertensive, but all of a sudden, inside the pregnancy, the BP started going up. That is pregnancy-induced. However, there is one that is of a more consequence, and that one is what is called pre-eclampsia. And that this woman never been pregnant before, never been hypertensive before, and all of a sudden, about 20 weeks of that particular pregnancy, all of a sudden, the BP started going up. And not just that the BP started going up, they start tracing protein in the urine. Listen to me and listen go. If they tell you they found protein in your urine, don't sweep it under the carpet. You will, at that point, we need a very close monitoring. Very, very close monitoring. Unfortunate to mention that preeclampsia is a progressive disease. That sometimes I wish it doesn't come too early. Because if the BP continue to go up, that same woman may convulse. And if some can convulse one and die, some can convulse twice and all that, they are no more. So it becomes imperative that for such a woman, it's not a woman that should be managed in maternity hospital or in a maternity home, or you say that I register somewhere. No, you need a full presence of a doctor and the follow-up team. There are a lot of teams that are involved in taking care of this woman until delivery. Now, in a situation a woman has suffered that before, it's a fearful situation. Now, the woman will be as if she wants to die and all that. And then you are asking the woman, come back again and get pregnant. Someone said, no, I won't try to get pregnant again. That calls for that pre-war, pregnancy war, counseling. All right? Despite how bad that particular condition has been, NICE guideline, National Institution of Healthcare Excellence in UK, brought out a guideline which is evidence-based. And that guideline for the preeclampsia, it states that for this woman before achieving pregnancy, hello dear, hello, come. You have a call?
I didn't lock the car. I want to lock the car.
No, see, I didn't pay.
Yeah, just to stand there. Just outside the...
Just if you reach outside, you go here, pay.
Please, let me be sure.
And you know what? Why did I have to stop for you? You don't need to apologize. There is nothing much. You can't pay for this. It's a knowledge you have, not just for yourself, for your children, for your family member, for your friends. You can be the one to save them. So when you move, my spirit was great. And that's why I have to say, receive this. It's important for you and your family. Okay. Are we together?
Yes, sir.
Now, we're looking at issue of what's the subject? Pre-war? Pre-pregnancy counseling. But what did I say about pre-eclampsia? Let me see your hand. There are two things I say about pre-eclampsia. Let me know you are following on. It's a progressive disease, one. Protein in the urine, two. That's what is called eclampsia, yes. High blood pressure in pregnancy. Perfect. Are you with me? That case is something that we are saying this person was never hypertensive before pregnancy. So it happened inside the pregnancy. Right. It could also happen when a person who is already hypertensive, but in the course of the pregnancy, protein is being found in urine. That is to say, chronic hypertension superimposed by what? Preeclampsia. Did you get what that one? Did you get the language now? This person is already what? Hypertensive, got into the pregnancy, and they started finding what? Protein in the urine. So that one is so chronic what? Hypertension superimposed by what? Preeclampsia. Did you get that? Not BB grammar now. But I will break it down in a way you should understand. But by and by, when a woman has suffered such, they also associated with leg swelling. But leg swelling is not absolute factor to consider because pregnancy is also associated with leg swelling because of the hemodilution fluid in the body, and also if the head of the baby is pressing on the inferior vena cava, the leg can be swollen. So that is not like a major, but once protein is found in the urine, is of a major consequence. Are we together?
Yes, sir.
Interesting. So going further from this, we are saying that there is what is called NICE guideline. This NICE guideline is what helps us to now know how to monitor women that may have suffered that before or having one tendency of suffering that pregnancy wise. Number one is that there are risk factors in these women, and this risk factor is grouped into two. They call one is major risk factor. The second one is called moderate risk factor. Listen to me, what you are getting now is not what you are suffering, but you are being empowered. One is what?
Major risk factor.
Second one, moderate risk factor. The major risk factors are if this woman, number one, has kidney-related problem, chronic renal disease. Two, if this woman has chronic hypertension or have suffered preeclampsia in the previous pregnancy. Three, if this woman has what is called systemic lupus erythematosus, SLE, or autoimmune disease, all right? That when this woman have any of these, she is grouped under what? Major risk group. Are you with me? Then, on this other side of the divide, on moderate risk, question is, this particular woman, is there any family history of preeclampsia? What I mean that maybe the sister, the mother, or the sibling or something suffered them in their own pregnancy, number one. Two, is this woman obese? Is it very fat? Three, is it a case of multiple pregnancy? Four, is this woman in a state of what they call extreme age? Extreme age in the sense that, is this woman below 20 or above 35? Don't worry, in obstetrics, the age is not the usual age. Just, I mean, from 35 is considered, if you are getting pregnant at that time for the first time, they call you elderly primigravida. Do you understand me? So it's group among that's below 20 and above 35 years. Is this woman in this category? And then, is this woman getting pregnant for the first time? Just talking about that very primary. Furthermore, this particular woman, is he having any problem that has to do, like, in IVF? IVF is associated with multiple, so it's also grouped inside that. And the last one they call about long pregnancy interval. Interpregnancy interval that is very long. What does that mean? Interval between two. If I say this person born today, and now take another 10 years, it can born another one. They group all of people suffering or belonging to this kind of experience under moderate group. And the treatment model says, if a woman has one major risk factor or two major risk factor, that particular woman should be placed on vasopril one daily from 12th week of pregnancy till delivery. Did you see that very major? From 12th week till delivery, that can make that woman to come out of that very unfortunate situation. Does it make sense?
Yes.
Huh? Huh?
Yes, sir.
Tell me what I talk. Just the way you understand it in your own group.
He says when a woman gets pregnant after a long interval.
No, okay, yes, you are that's one of the factors. But now I said, if this woman has one or what major risk, or two of what moderate risk, that this woman should be given a tablet, that vasopressin. In United States, you have 150 milligram, but we have 75 milligram here. That's no problem. So you take it one every day, starting from where? 12 weeks of that pregnancy till the end. Are we together? So, you get that?
Yes, sir.
Interesting. So, that is what is called pre-pregnancy what? Counseling. You see, that it's not just about getting what? Pregnant. A lot of other things, your drugs, behavioral habits the person has been. Is this person a smoker? Does this person drink? Does this person do? What kind of lifestyle? All these things should be put into consideration before pregnancy. Then we go now into the one that is of also important to us, which is the issue of you getting pregnant and not to have miscarriage. Okay?
Yes.
Now, for you to achieve pregnancy, there should be an interaction between the egg and the sperm. You got that? But that thing does not actually happen everywhere. Okay, if you have a look at this. Okay, this is the reproductive tree. As a matter of fact, this is the vagina. Go inside, you meet the mouth of the cervix, the mouth of the womb. If you put your hand right inside the vagina, you meet a place like the tip of the nose. And that is, some people may touch, I say there's something I'm touching, a normal thing. Some people own can be longer than the other person. So are you with me? But that is where the menses come out. That is where your baby will come out also. So when we get there, we'll talk more on that. So you get there, then you enter inside the womb. There's a hole also that goes through here. They call it the fallopian tube, and it gets to the ovary. Now, if you look at this, can you see it now? Are you people seeing it? No? Yes. All right. Now, if this egg, every month, a woman under normal reproductive listen, we produce one egg majorly. They call it ovulation. When that egg bursts, they call it ovulation. And this egg will be released, and that very fallopian tube having the fibrin end will just pick it up. And when it picks it, it enters here. If on that ovulation period, the man comes in here and deposits the sperm will travel into the womb and gets into this fallopian tube. Two of them will meet here, and you will call it fertilization. The meeting of the egg and the sperm to form a baby is called the fertilization. But do you know the interesting thing about this? The interesting thing here is that pregnancy does not start forming in the womb. It starts where? It's an interesting thing, isn't it? I will use it to tell you something. That's why. It starts in the fallopian tube, and they meet here to form a baby. But within 4 days thereabout, there's something that the legs of millipede that will be moving like this, and carried it and come here and implant it. Another side is the stage of fertilization, implantation inside the womb. Why you see some people, they said she became pregnant, all of a sudden 3-5 days you will see the period. That could happen when fertilization occurs, but there's an implantation failure. That's for those looking for the fruit of the womb. Today we'll talk about it. Now, this one will now happen here. The baby should be here, and it's expected to move to here. In a situation where this particular movement failed to occur, the baby will be trapped inside here. And that is what is called ectopic pregnancy. What? Ectopic pregnancy. Ectopic pregnancy. Ectopic pregnancy is simply pregnancy that is occurring outside what? Perfect. Right. I'll make una clap for una say, see hustle. Somebody said that, Dr. Ko, if you teach me, I will be a medical doctor. You know, we're actually coming up with our university, our after Bibo. It's a medical university. Okay, see, it's called ectopic pregnancy. This particular woman, if you check the blood, it will be positive. Are you with me? But this is dangerous. Dangerous in the sense that the diameter of this fallopian tube is like the diameter of a thread, very tiny. In other words, the baby staying here will not be able to survive after 2-3 months. If nothing is discovered early, that brings us to when should I register for antenatal? Before this time, we used to say, no, you have to wait, after 4 months or when you feel kick, all right? Then that's when you come. But that by then, the worst had already happened in the life of that woman, if it is ectopic related. That is why the current trend that once you register pregnancy, you can do what? Be in position to come for antenatal. It can help you a lot, but they can give you a gap of one month in between. So what happened? This is something that makes some women, on the course of this thing growing, if you burst inside, that woman can die. She will bleed and bleed and bleed. That's why some of them can just slump and it goes. And that is one of the key things I want to tell you. In any hospital where you are having your antenatal or you have somebody to talk about, always have, even if you are having antenatal in anywhere, be it a maternity, whatever, always get attached to a hospital where you have anesthetics, possibly resident or easily accessible. You have gynaes easily accessible. You have all the necessary team available, because this particular woman, it just needs a little time to be saved. That's why you see a shell, once they have problem, they will rush, because here they know that 247, even if it is any time you call it AM, whatever, we are standing by for this kind of emergency, or woman having a respiratory distress over her baby and all those complications. So this kind of a thing could be in position to happen. You call it ectopic pregnancy. So on that very accord, which one is that? All right. I just want to confirm that what she's writing is what I'm saying. Oh dear God. Did you get the topic well? Yes, sir. Because there happened to be one man that was suspecting the wife. The wife happened to have, he's suspecting one man from East Africa. He thinks that the man was dating the wife. And as in that very suspicion, one of the days, the woman collapsed and they rushed the woman she was pregnant already, and they rushed the woman to the hospital. And they searched and eventually got the man and called him on phone. I said, sir, the doctor said, sir, please rush to the hospital right now. Your wife has ectopic pregnancy. Immediately over the man said, bam, I know it will happen. Bam, I know it. Ethiopian pregnancy. So he will rush. He rush and just says, doctor, yes, where is she? He said, no, their wife is in a very serious distress. And we have to do something. He said, I know it. I know it will happen. He now went to the woman and was asking her, who is this Ethiopian? Talk the truth and tell me. The doctor said you have Ethiopian pregnancy. Talk the truth and shame the devil. I hope no be Ethiopian lady. Ethiopic is E-C. Okay. Okay, we go on. That smudges make you wake up. Okay, we go on. These are some of the things, one that could happen in pregnancy. Some of you must have bypassed this very stage. But we look at another thing that has to do with bleeding. Bleeding is one common thing that happens in a pregnancy, perhaps could be described as a complication of pregnancy. But when this implantation originally at that early stage happening, sometimes if the invasion of that very embryo into the womb miss a particular vessel, it may bleed. But that bleeding may just come and stop. It is called implantation or breakthrough bleeding. All right? But doesn't normally last. But the next thing that happens in the aspect of miscarriage, in the aspect of miscarriage has to do with early miscarriages. There are people that used to have miscarriage early in pregnancy. Miscarriages that happen within the first trimester, when you try means 3. That 1, 2, 3, 1, 2, 3, 1, 2, 3. That is 9 months into 3 trimesters. First, second, and the third. All right. So the first trimester miscarriages have been found mainly to be as a result of chromosomal abnormality. What? Yes, that very mix-up of that chromosome from the man and the 23 from the woman. If there be an abnormality in it, sometimes nature use a means of taking it up. Second one that could also happen in that early pregnancy is what is called luteal stage insufficiency. Usually when the ovary releases the egg and pregnancy occurs, it turns into what is called corpus luteum. That corpus luteum is what produces the hormone that sustains pregnancy, majorly progesterone. All right? But in a situation that the progesterone is producing is not sufficient, the tendency of that woman having bleeding and can have that miscarriage. That's why most people that have recurrent miscarriages about that time, you may give them what is called luteal support to support them within that very first trimester until placenta get developed and then taking it off from there. Are you with me? Are you getting something here?
Yes, sir.
Huh?
Yes, sir.
Make you not be like judo. There's one guy in school that time. If teacher asks me something, he go first raise hand and fill it before other people will answer. We raise hand, make sure that you fill it first. So most time when he raise hand, there's no need of asking because you know the result. Okay, you there, you go just. So I hope we are following now. Okay. So we are talking about first trimester miscarriage. And then let's look at the one that is so traumatic. Traumatic in the sense that there are women you know that about 4 to 6 months, 4 or 5 months of pregnancy, not just like they say the bag bursts and the whole of the baby will just come out. Or sometimes you even see the entire baby still inside the polythene. Do you understand me? inside that amniotic sac, all of them will just come out like that. Some people have had such miscarriage over and over and over and over again. They call it habitual abortion. All right? It happens over and over again. What usually causes such in a number of occasions is what is called cervical incompetence. Listen to me. If we have something, let me see if I have something close to that here. Incompetence. The thing is not. Now look at it. You can see that. Welcome. Okay. So I hope. Will you mind to use this one? All right. So this particular service will be like, you know, when you have elastic band that is very tight. This band will remain tight until labor will trigger the opening gradually when the baby don't mature. So it is expected that this womb, this very service, will remain very tight, so that irrespective of the weight of the baby, it will be there. But in a situation where this very band is compromised in the sense that, you know, rubber band, some rubber band, you go do like this, boom, it go come back. But over time, you stretch it. You find that if it's coming back, you know, say don't weak. All right? Perfect. With that picture, you can understand what I want to say now. When the baby started like a tiny thing like this, no problem. It doesn't have weight within the first 3 months. But after 4 months, when the weight of the baby starts getting up, and now landing here, it has started becoming a pressure. You understand me? And if that band is not so strong, over the time it will be opening like a funnel, gradually. And if nothing is done at that point, all of them will come out. So this, once there is a weakness of that service, it can happen over and over and over again. Did you get that? My friend, tell me your sickness, make we treat them at once. Tiredness in pregnancy, okay. Okay, are we together? So this can cause what? Incompetence. It can come frequent miscarriage, all right. Now, one more thing that can happen also here is that if you have a fibroid that is seated inside, that a woman has fibroid does not mean that that woman should not be able to achieve pregnancy. Let's get it very clear. The issue of fibroid is that fibroid is associated with miscarriage one if it is a submucous fibroid. Submucous fibroid, this is the womb, but it has 3 layers. You have the outer layer, the serous, subserous, you have the intramural, and then you have this inner lining. You call it submucous. Fibroid can be inside here, can be here, or can be here. You find that the ones that are here may not affect this inner side much. That's why you see some people say that I have fibroid, but my fibroid is outside the womb. It's not true. All fibroids are inside the womb, except rare one that is called ligamentous fibroid. It's very rare. So, but all of them can be here. However, if it is somewhere here, it may not affect pregnancy. All right? So it all depends on the location of that fibroid or the size of the fibroid. Be that as it may, fibroid that is located inside the inner lining of the womb is prone to cause miscarriage. Are you with me? So the tendency of miscarriage could be there. By and by, it's also important to know that even when a woman has fibroid and she's pregnant, there could be what is called rare degeneration of fibroid in pregnancy, and it is associated with intermittent pain. The woman will be having pain. It will come. You just have to give an injection, maybe pentazocine. The woman can be fine. but it will happen because of at the point where the fibroid is there, it may begin to liquefy. Those degenerative changes, it may be causing pain at that time because the food that is there, the baby may be chopping more. And the only way to show you, say, I know the chop enough, is to cause you pain. Because they can if no blood coming to a place, it will cause ischemia. So the person will be pain, will be there. All right? So such could happen. All right? Having said that, we are coming to conclusion or something. Are you getting something here? Yes. I bet make una clap for me. Now also why I also call the tell you this. When I was in school, my survival was in so many means. I discovered that I will read book. After I finish reading it, I will do the Made Easy series. ONG Made Easy, Obstetric Made Easy, Surgery Made Easy. I made all those Made Easy series. So I started selling it in school. Now survival, that no be today where I begin hustle. So when I read the books, I will make it in a way you will use it to pass exam. So I started selling it. So so that's the kind of Made Easy series I'm making for you people now. But this one will not pay me. Only that it's a passion thing anyway. All right. We go a little further. This time around, we're going to look at the issue of some problem that could happen in pregnancy, and very dangerous if it happened before the first 28 weeks. Now, in the aspect of what is called malaria in pregnancy. Malaria what? Very dangerous. You know, malaria is very dangerous for any pregnant woman. Unfortunately, malaria symptoms, you shouldn't wait for it because malaria can be causing problem. Malaria parasite can be causing problem in a pregnant woman without her feeling the symptom, but the baby is already gone. Do you get me? So that is the reason why the protocol of intermittent prophylactic therapy actually come on board concerning malaria management. Listen to me. Malaria can cause a lot of problems. Number one, for the mother, it can cause cerebral malaria. The woman can die because of malaria. Very serious. Number two, hyperparasitemia, that is a high level of that malaria parasite inside the placenta. We make oxygen not to be reaching to the baby, food not to be reaching to the baby. So it is associated with low birth weight. The baby will become periwinkle. You begin to, this time baby, we can't do periwinkle like this. Look at my size. Now you cause up. So malaria is a very bad thing, and you know we are in an endemic region of malaria. Malaria can cause preterm delivery, premature. It could also be in position to cause intrauterine fetal death. The baby may die inside. Be that very serious, therefore, it becomes something, a protocol was established that at least you should be able to take 3 doses of your anti-malaria before your pregnancy is over, particularly we that's in the endemic region. And that very protocol, in fact, which is by reason of the recommendation, is supposed to be direct observation therapy. What I mean that as you come to hospital like this, the matron should see you. Swallow. You know, some of you, they give you the drug, you feel blue like this. They say, you know, swallow. You go pray. No. It's direct observation therapy you take it. So it is actually recommended that within that particular 4 months, all right, from 16 weeks, you should, once you have quickening can happen 16 ways in people that have delivered before. Are you with me? And somebody who is delivering or getting pregnant for the first time may have the first quickening around 18 weeks. So, whichever, once that very first quickening is established, you are meant to take this very drug one every month. Are you with me? At least once every month, depending on how the dosage of the duration of your pregnancy, but at least to give you a cover. And it is recommended all this group of sulfadazine pyrimethamine, where you could have this Fancida, Swiffer, Suida, all those, any of those groups, all right? That those groups should be taken bolus, that's every month. Don't take it because I'm not feeling anything. As earlier said, a pregnant woman may not feel symptoms, but for the sake of your baby. Second one also is that some people react to sulfur, all right? For such people, they have to now go to this proguanil, the one that they have to take once daily, all right? They will take it one daily for that particular period. All right, you continue it on pregnancy. Initially, it was actually before this time. That was a couple of years back. It was actually predicted that taking those drugs into to the end of the pregnancy, it used to cause what is called hyperbilirubinemia. Hyperbilirubinemia is this thing that called jaundice, you know. But the World Health Organization has been able to, through the recent research, disprove that you can take it till your time of pregnancy is over. Are we together? Yes. So malaria in pregnancy is not a good thing. So also UTI in pregnancy. Don't forget that pregnancy is associated, is immunosuppressive. What do I mean by immunosuppressive? Pregnancy lowers the immunity of a woman. Did you get what I mean? Just like HIV and all those things. Pregnancy lowers the immunity of a woman. So, on that particular accord, it is experienced that there are tendency of infection coming in, urinary tract infection. Urinary tract infection almost behaves to the baby the same way malaria behaves. So it is expected that if you are urinating frequently and you have been shown that you are not diabetic, while the culture is ongoing, it is important that the treatment be instituted. Are you with me? So you see all this nitrofurantoin or nalidic acid, any of them has been found very safe in pregnancy. Then we go further to the aspect that has to do with anemia. Listen to me, this is also very critical. Anemia. What is anemia? Who knows? Release of the blood.
Disease.
I love you. You know, sometimes it's good to start. Don't see. The beautiful thing about life is that, why am I here? Now maybe this Dr. Richard Okoye, you people are here, you know. But it's a product of both failure. I know they give up. I lost 241 million in 2018 to fire. In one of the projects, you know, I will have this hospital in Owerri. All the things they brought, and I took that 300 million from Access Bank to do that thing. Only one day they say, fire, fire, fire. I went there. One of the equipment, 87 million, smoke was coming out of it. I will tell you something that will help you so that you can also encourage your husband in certain situation. They said, fire, 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 fire. I got there. In fact, they called my wife thinking I go die. You are the one that built this very house, this house is not as important as you yourself, because this is only a product of your brain. True of us? You can do it again. You can even build something bigger. And I got there, I saw the fire coming. And I said to that smoke, your heat will not near my family. Your heat will not near anyone connected to Save a Life. I came back. Why people want me to believe that it's as a result of the enemy, which is demons? Nonsense. Is to paralyze their mind. I went inside. I said, Lord, what do you have me do? What next? One bad thing in our society today is that if you have a challenge, which even God himself can bring to help the best out of you come out, they will come and tell you that it's because of your sin. Because you no pay tithe, you no pay offering. That's why what is happening to you. So you now go down with guilt instead of facing challenge the way it is. Did you get me right? No mistake. There's no mistake in life. Face it. I started thinking, Lord, what do you have me do? And I know that if I leave these people without paying their salaries, they will put pressure on me. I took 150 million and paid them salary that very year. And I was thinking, the same money now people say was lost. I have over 20 million US dollar company in America. What am I trying to put across to all? Failure is not what? Final. Where we were building that very house, when I was doing the asphalting of the place, one pastor that was by us, I was building it and I saw his church and I said, okay, let me be in position to, since people will come to the hospital, let them have somewhere nice or the building near it is good. So I asked the architect to design a beautiful church I will build for him there, concurrently while we are doing that. And only for me just for him to go and present the design to him, that we want to do this, let's be able to plan. It was then I realized that he wasn't even telling me the truth, that the place wasn't even his own, and all those kind of stuff. But only for when that fire happened, after the fire incident, he one day sent me something on WhatsApp and showed me where one white handkerchief and a charm on tip, near the sun, and he showed me again where he ignited it with fire. All right. So now he told me that the devil, the enemy came, but the Lord dealt with it. All right. Just because he must have thought that now that I'm under this kind of situation, I must have also been in position to be thinking of those that are after me and all those things. When I saw the thing, I came to the site and asked them, how many of us saw this? They said, no, Oga, we don't see this thing and all that. I went to man of God and asked him, man of God, where is that my charm? Was the charm meant for you? It's my own. I better give me my charm. Till today, we are still looking for that charm. If I show up, it disappears. Listen to me. Why am I bringing this also? Don't be deceived. Don't be what? Deceived. He said, ye are of God, little children, and overcome them. For greater what? Is he that is in you than he that is in the world. Lay nobody. If you are here, listen to me. I want to tell you something. If you are here and you are going where they are prophesying to you, you are leading yourself into bondage. Any place, from this pregnancy now, you will carry yourself. Somebody just don't prophesy. Somebody prophesy to you. Hey, is he your guy? Just to make sure you don't get peace. And peacelessness can cause miscarriage. You are not aware? Hey, they say this one, they say this one. What is it for? If it's a challenge, face it. If it's a challenge, do what? Face it, my friend. Then nobody tell you nonsense. If you dream it, God will reveal to redeem. You dream now, they say you saw somewhere, this other one, the other one. Get up and do what? Pray. And pray. And when you pray, they say, forget about it, it will never happen. It's very important I mention it because some of you now, you don't miss even this pregnancy with spirit. I don't know what you want born. You want to find out whether I carry Jesus or John the Baptist. Okay. Now, we look at again, anemia in what? Pregnancy. Yes, anemia in pregnancy is when the blood level is low. Now, World Health Organization stated that a pregnant woman should have a blood level, and that blood level should be up to 33% PCV. Now, listen to me. One man was talking to me. He went and withdrew the niece from the marriage. Said that the man want to kill her. That the man want to kill her. And I was telling him and said, why are you interfering like this in these people's marriage? Why not allow these young people to be able to sort out themselves? He said, Richard, do you know what you are talking? Do you know what you are calling? Did you know that? Did you know that this young girl, the PCV just 30%, 30%, you want her to die? PCV 30%. I said, For our environment, 30% is a normal PCV. You know why? Because they are thinking that PCV is over 100. My sister, my brother, no biam. It is not what? No, over 100. Even men is just about 45. So within 45 and 30. He said, but pregnancy-wise, World Health Organization said 33%, which is 11 grams per GL. But for those in endemic region of tropical region of where malaria and all that is predominant, and they said, well, 30%, that the PCV of a woman should be 30%. Now, if a woman gets fat, if a woman, pregnancy will add a lot of fluid in the body. If you add a lot of fluid in the body, it may cause a physiological anemia, what is by reason of hemodilution. Hemodilution is something that salt now is there already, the same amount of salt, but the more you add water, the taste of the salt will not be, that is hemodilution of this, but the concentration is still the same. Are you with me? So that can happen. It is a normal thing in pregnancy. However, in a situation a woman's blood level is low, it is an alarm. Shout! Number one, it can cause the woman to have tiredness, overwhelming tiredness. The woman can become dizzy. It's as if the eyes are turning her. If nothing is done, the leg gets getting swollen, which is not just only the pregnancy, but because the blood level at that time and the heart is no longer working well. So the heart will not be able to be pumping blood the way it's supposed to be pumping. You see, the woman, if she does very small thing, she'll be so tired.
You
get that? I've been seeing them now. If I know at which me I know they see them before. So when the blood level is low, the person will go into what is called anemic heart failure. Anemic what? Heart failure. You will be so tired, the leg will start getting abnormally swollen, and at that point, if it gets something small, it will get so weak. It also happens in a non-pregnant person. So when you see such people, know that their heart is not doing well. So that's dangerous. For the woman that the blood level is low, apart from what will happen to the baby, which we are going to talk about, this woman may have problems during delivery. Number one is, it is the blood that will bring in what when you open, if there's any bleeding, it is the blood that will bring all those platelets. Are you with me? That will now make the bleeding to stop. You know, usually, when, if the baby is delivered, the womb is still big. Are you with me? And become very, very flappy. But immediately the baby comes out, their womb should begin to contract, because if it doesn't contract, blood will be pouring and pouring. That is one of the common cause of removal of the womb during delivery. The womb will be pouring and pouring. It's not contracting, because it is the blood that will bring in the materials that will help both in the contraction and also in the aspect of stopping bleeding. So a woman that has anemia in pregnancy, that anemia must be corrected before the delivery. Did you get that? That anemia what? Must be corrected before delivery. Very essential. Second, because it is also the blood that brings into the womb the thing that will, the immuno components that should be able to cause womb healing. So a woman that has anemia, the wound will not be able to heal. And that's why you see some people after surgery, if the blood level is normal, you find out that the womb will be breaking down. So there will be poor wound healing. There's also a possibility of what is called thromboembolism and some other complication that can arise. So this woman will be prone to infection. The infection will be very, very high and could cause serious problem to the woman. Or otherwise what is called septicemia, when the infection has gone around the whole body. All right? Are you getting something here?
Yes, sir.
Are we together?
Yes,
Huh?
yes.
Why? Huh? We'll go now. Go now. When you come, I will do a little summary. Okay. So I bet make you no fear when he can't hold you like that. Yeah. And you know this is what we do when we are in school. Another, the third person follow. Eh? You go follow him, he go there, then the way he did there too. Nothing they come out, but he just go because other people have gone out of the class. Okay, I'm waiting for you people, sharp, sharp. Okay, we are gisting. Are you with me? So the issue that has to do with anemia is that I pointed out one thing. What are the complications you can find in the woman that the blood level is low? Number one? I want to dizziness, swollen legs, poor wound healing. Yes, among voices.
It causes heart failure.
It causes heart failure, yes. My friends, talk one, even if they don't talk. And the one thing that if you don't talk the one way they don't talk. Which one? It causes heart failure. Hey, my sister, waiting be heart failure.
Your heart is not beating very well.
Okay, so you will not be able to supply the blood. Make me a clap for him. You will stop. Okay, yes. My friend, you are stuffed now. Yeah, just one of the, when the blood level is low. Men, tell us something. I talk about when a woman is suffering from anemia, what are the things that could happen, even and during delivery? No contraction, meaning that the woman will bleed too much. Yes? Say the one that they don't say. Because these are some of the things. Poor wound healing, perfect. Remember one. Yes. Postpartum hemorrhage. Chairman, I think they don't talk within their mind. Okay, that's a very interesting one. So, now for the baby, listen to me, this is very important. When they tell you your blood level is low, be inquisitive to ask, what do I do? If it is something that is not correctable through food, if it requires transfusion, get transfused as quickly as possible. When the blood level is low, think of a baby that is living in a state of kwashiorkor. So it means that that very baby will be low birth weight. And don't forget that when a baby has low birth weight, that is pathological. What I mean pathological in the sense that it's not it's a disease kind of a case like that. When his birth weight is low, that particular baby, even the brain will not develop very, very well. Because your baby in the womb, it is better you are getting slim, but let that baby be feeding well. Very, very important and very key. So, on that particular accord, it discovered that that very baby can suffer from retarded growth, it can suffer from low birth weight, it can premature, what is called premature, mature, anything premature, premature contraction, premature delivery, everything premature can happen to that, and that baby can die. Yes, that very baby can die inside. That very baby is also the type of baby you will deliver. That baby won't cry. That very baby won't be able to cry. And that is a very, very, very bad one. So, in the summary of the same, I want to finally give you this information on Godwin. Where is it? You couldn't find it.
I'm still searching for all the folders.
No, what things now? This is one thing that happened, and I want to tell you because it happened to one of the patients. That's the essence of this very teaching I'm just giving. I discovered that ever since we started this, we have never had one single case that is that complex, because both the woman and the doctor, everybody already in the same page. Why such complication arise? There's a woman that bled, that almost 10 pints of blood was given to her. In the recent, I will show you what really happened. And that's why in any hospital where you are to be, please, pregnancy is undefined. It's a kind of situation that you can't predict 100% what will happen. Are you with me? You can't be in position to predict it 100%. And on that particular accord, where are these my people? For how long? For how long? If to say they pay for this, they will be there drink their urine and continue what they are doing. Listen to me, I'm a very, very easygoing person, but I hate ignorance. And I hate when people don't desire to know. It hurts. You know what it's called? It hurts. It hurts that the same thing now I'm talking, somebody will go and fall victim of it and be paying money. Please. The only honor I want you to give to me is just to be in position. Pay attention, because I believe that through you somebody else can be saved. Okay, now, one major thing is, this is how the baby stays in the womb. The baby is actually meant majorly to stay inside this womb, but don't mind about the sitting position. We're not talking about it for now. This very placenta, this red one, is called placenta. In a normal situation, this placenta should be off. This placenta should be off from this place the baby is supposed to come out. Are you with me? Because this placenta is a bag of blood. Anything that touches placenta, boom, you will see bleeding that you can't control. So, but when placenta now, instead of being on the part away from where the baby should come out, this very placenta now is located inside. So you have, the placenta could be here, it could be like this, it could also cover the whole. This is what is called measured degree placenta previa. That this is called placenta previa when the placenta is low-lying. Are you with me? Now, at the early stage of the pregnancies, if it happens this way, sometimes when pregnancy now take up to 32 weeks and above, this may eventually begin to chief small. Are you with me? But in a situation where it is this way, there's nothing anybody could do. When a woman has a low-lying placenta, that is when it is contrarily indicated for any doctor to do vaginal examination on this woman. It is not all women that both the matron or the doctor is allowed to do what? Vaginal examination, because you may just go to do this thing, boom, this woman will bleed because you don't have where to tie. Can you put down your phone and silence? It's distracting us. Are you with me? If you don't boom, it may bleed in a manner that it may not be in position to control because you don't have anywhere to tie it. On its own, it bleeds from time to time. That's the common of people who say that I saw bleeding. I saw bleeding. From time to time, they may be admitted. The bleeding will stop. They go out again. After a while, if the woman chews small, if that, it may bleed. So it is a contraindicated that you should not try in any way to do vaginal examination on this woman. What about delivery? But I think this woman now can be allowed to deliver. You will kill the woman and kill the baby. So, and that's why you see people say, I'm doing antenatal somewhere, no scan, nothing. Even when there is a challenge, nobody could be in position to do. Listen to me. This particular thing is, when it is major degree, is an absolute indication for cesarean section. That does not mean that once this person gets CS done because of this, he must do CS in all of the subsequent pregnancies. No. The next pregnancy, this may not happen. It may be planted here. Are you with me? So such could be in position to happen. And then one major thing I want to point out here is that this is one of the major challenges you will also meet during delivery. As I was just telling you about that woman. Placenta is usually planted, and you know they have the second stage of the labor, which is for you to deliver the baby. The third stage of the labor is for you to deliver the placenta. This placenta is just like, look at this very wall. All right? When you drag the placenta, it will just follow you. It's not attached to this wall, absolutely. All right? Not difficult. So when you pull it. But how many of us grew in the village? If you know you grew up in the village, let me see your hand. See for more. But they raise your hand up. Let me be honest with you. If you didn't grow up from the village, you miss out. You missed out a lot. This sweetness of the story is that he came from what? Village. The village. Yeah. I have understanding. I was telling somebody who was calling me this morning, I said, listen to me. Greediness is a function of lack. When you meet abundance, you find that there's nothing like greed. Are you with me? Those times we were in the village where they will put rice in a very big tray. Everybody, spoon will just be around it. Everybody will be seated. Woe unto you if you want to use spoon. Because if you use spoon, you will suffer. It's for you to remove your spoon and hold on your left hand and use your hand. You see where you are molding rice. Oh, my friend, collect 5. Hey, but now it's the same location with me. Listen to me. You know why I'm doing this? The truth of the matter. If you forget where you are coming from, you are most like... You see all this pride, you see people, pride. Somebody who, because they just give him an opportunity, the next day will be as if they know Bonham, that they land from the air. That's why when they disappear from the scene, nobody will know. Never forget where you are coming from. You are not listen to me. It's not who your father is, it's what you are. Exactly. Did you hear me? My father was. Yes, it was. What are you what? Now. Not what your father used to be. Don't form anything. You know, I've been privileged to meet billionaires in America, and I learned what is say natural life. These guys, you will just come in, you sit as though. You know, that's why I say, if you claim, do you know who I am? The question is, who do you think, who do you compare yourself with? If you compare yourself with local champions, it thinks that you have arrived. But if you have another set of people, as one may call me now a rich man, as rich as I am, Dangote will use all I have and do offering. Is it not enough to humble you? Supposed to drop your hand. You can use everything you think you have. My man, God's come to think about you, everything where you have. That somebody will come for offering, dance, bring a chick. And never remember say drop the offering. Are you with me? God will help us. If you grow up from the village, it will help you understand what I mean now. I want to talk about placenta accreta. You know, if you see yam, there are yam tubers that are very smooth body. At least you buy yam now, you understand. Very smooth body, isn't it? If you are in the village to harvest such yam, very easy. You can just dig and dig and dig. After a level, you just pull it. It will follow you. All right? But there's another type that used to have thorns on the body. Have you seen such yam? Yes. It has thorns. Such one, if you are to dig it, you have to dig and get to the bottom before you leave. Otherwise, no matter how it is, once you leave, you hear, boom. Who did hear that kind of sound before? If you grew up in the village, you understand this. It was from the village I saw two fowl. I saw the fowl, this hen, how they lay eggs, and they will later abandon it. And when you break that hen, you will see the chicken inside, but it's not able to hatch it. And I started studying. That's where I learned embryology. From village, embryology. What made this hen not to hatch this egg? That is the same thing that happened when a baby, when the skin, or what you call the, you know, if a hen lays egg now, those young ones, once you touch the skin, shell, it don't break, isn't it? By the time they stay older, the same hen will lay egg, but even if you hit them on your head, you go there. They will not lay only to stay on that egg, you will not be able to hatch it. And after a while, you will abandon it. You will see that chicken dead. And I come to study woman nature. That after certain age in a woman, the zona pellucida, the rounding up of the egg, will start getting thicker and brownish. That's why the older a woman goes, the less the chances of her getting pregnant. Quite unlike who used to be touch and follow. You understand the thing? So I learned this thing day. So when it is being taught, it's not being, I'm not reading textbook stuff. I've already seen it even before I read it in school. So that's why never you forget where you are coming from. Be proud of it. Your testimony is that I was this before. But by the grace of God, I am what I am today. I met one fellow, this guy called me this morning. He said, please, I just want to use my brand. I laugh. He said, whatever you want. He's coming to see me, him and the Kanu one Wednesday next week. So he said, I want you to use my brand. Please, see, you know why? Okay, I will not tell you the gist because there's something we're actually launching that in our Abuja center just called us. There are things you should be able to know, time and the what season. They're always there. Be your natural self. Be what you are today. Tomorrow day, you will definitely be better than what you are today. Say amen like that. Yeah. For sure. Okay. Now, a very important way to talk about this. See, that other type of yam that had that thing that if you draw, sometimes an ugly situation, not the woman's fault, not anybody, but maybe one thing or the other, this very placenta, instead of having that smooth surface, it will grow that thorns into the muscles of the womb. And when it grow that thorns, they call it placenta accreta. Some can be called increta and pancreta. That the one we saw last 2 weeks grew from the wall of the womb, passed and was attaching to even intestine. That is what was desired. That woman would have died. Nothing would have helped out that woman. But because we have a blood bank here, I provided that blood bank. Even if any hospital have any emergency, let them call, we will give. Because if that blood bank is not there, there's no way. Because the whole place will be bleeding, it can't contract, the woman will be pouring. Even to remove the womb is a problem. Because it has attached to different places. So we have to be in position to work it and be able to excise that very part where the placenta is and close it back. That is how that woman's life was saved. So this situation is the reason why you hear that they try the theater, either the woman die, or that they say they remove the womb, or whatever be the reason. But that's why whatever happened, be in a center available. Let it be that the best has been done and the rest of it you hand over to God. I think that's where we will stop in today's edition. The dietitian, you people have been in touch with him. He will also come in to have one-on-ones. Do you have any question that you will ask? Tomorrow is for another version of people. So tomorrow is for where we will now talk about that causes of maternal mortality following delivery, and also how a woman can deliver a very sharp baby. Some women have actually, even though that, don't be so much worried, because before you will enter that phase, before you deliver, we will have this program again. So by then you have moved over to that age group. Are you with me? Yes. So nothing to worry. Okay?
Thank you, sir.
So when you were teaching about low anemia in pregnancy,
You went to eat.
You made mention of the anemia being corrected. How?
Okay. Perfect, my dear. Thank you for reminding me. Anemia, it can be caused by either this type of bleeding. Anemia can be caused by malaria. Are you with me? Malaria in pregnancy, UTI in pregnancy. Can cause by worm, all the hookworms and all that. Malaria can, anemia can also be caused in a situation where you are not eating very well, or you are taking your drugs with tea. Hello? What is required in that your routine in their routine? Is it off? Oh, thank you. What is required in that your routine drugs is the iron content of it, which is required for formation of the hemoglobin. All right? However, milk prevents absorption of iron. So when you are taking your routine drugs with tea, you are limiting the absorption of those ones, thereby preventing formation of that hemoglobin, the transport mechanism of the red blood cells. So all those, so the correction of it is correction of the cause. Where it is very severe, you can transfuse.
Hello, sir. Sorry, I want to ask. What causes ovarian cyst in pregnancy?
In pregnancy?
Yes, pregnant. Ovarian cyst. and also what can be done to avoid it or prevention or cure?
Thank you. The issue is that ovarian cysts during pregnancy, everything that has to do with ovarian function is suspended, only serving the pregnancy. That's why I said when the ovary ruptures to release the egg, and then the egg goes, it now form what is called corpus luteum that will be producing hormone. So I don't know what the scan is indicate. Why the indication for the scan, which was going. If you go to scan a pregnant woman, that corpus luteum may show something that somebody who doesn't understand may think it's a cyst. All right. So with pregnancy and the cyst coexisting, the emphasis is for the pregnancy to make progress, make nobody suffer. All right. Secondly, there is no drug. All this on the package, only God will help us. If you know the package small. One lady come make up. He can't use the makeup. Go save he can't use the face, can't do skin only for one night. One night he was the husband woke up, see her making up. He said, my friend, what is happening? By 2 a.m.? He said, no, I will try to open my phone, the phone no recognize my see my friend, see the way this my baby laugh as if they see your mom like that. So he go make up. So the one makeup came out, even the dog in the house began to shout. You don't know, say I'm madam. Everything come borrow, but like this, come borrow Butos join. I don't know. My eye they see. I happened to one funny occasion where one lady then just said, Doctor, please come and examine this my breast. I'm feeling something. I look at the way I said, no, leave her. He said, please just check him. I seen and gone. I seen they did this only for me to realize that this breast why they see for up here where now from where they for and he rolled the breast and put on top. By the time he removed the breast, the rate at which the breast fall. He said, Doc, what can you say about this? I said, leave him, is he cancer? I said, but leave him for this one. Cancer no go near him. If any cancer enter here, now hunger go kill him. Okay, my dear. Tell me.
Okay. I want to know what causes the testicular time after. I want to know what causes the testicular time after delivery, and can it be corrected in the next delivery?
The what?
What causes the testicular time and the testicular time after delivery? And can it be corrected in the next diathesis?
Huh? I'm not actually used to that very terminology. May I will look at it.
According to
Yeah, let's put it in the next side. There's no big deal about it.
D what? D-I-E. Okay.
D what? D. D-I-E. A. S-T-I. Oh yes. What I got here is just for people that have abdominal obesity. It's very common with those people.
The function of an expansion of the muscles during delivery, and after the delivery,
why it shouldn't come back again?
Delivery didn't come back.
Yeah,
Can it be corrected?
Yeah.
In the next pregnancy.
Pregnancy. That's when it has to do with this. They have determined this on that particular one. Has to do a lot with you. Exercise will be able just to help the abdomen a lot in terms of contraction. So most times after delivery, it's expected that you be, but yes, you start getting out. But in a situation where it doesn't go in, you can consider abdominoplasty. That plastic surgeons will be able just to help out in that area. Not necessary to put the muscle back. In abdominoplasty, what will happen is that excess one that goes down, you can be in position to stretch it a little and then create a hole where the nerve will come out.
Okay, can that be done? Maybe you had it in your first pregnancy. Can that be done
before the next one?
No, in your second pregnancy, if you're still going through that cesarean operation.
No. For me, it won't be nice. It's better when you are done with childbearing. You do all those body workup in terms of plastic surgery. You understand? So it's a plastic surgery related attention, but it can be done. There's a lady we are doing it for next week, but that one is abdominoplasty with liposuction. You know, because if you do abdominoplasty and towards the edges it may fold, but if you do a little liposuction of that two edges, so it can be able to be lap very well and look neat. But let's look at more of our gynae cases.
My gynae cases, I want to find out if actually if one can be able to predict the next baby's sex selection, and also if the ovulation egg, if it begins to rupture, what is the cause? Maybe you actually are trying to track.
Okay, the sex
selection, and maybe on your scan they are telling you that the ovulation is there, but that's not ruptured.
Not ovulation is there, that the follicle.
That the follicles are there, but that's not ruptured.
Interesting. The issue is that before you claim that ovulation has occurred, it is the rupture of that very follicle. So if it doesn't rupture, which means there is failed ovulation. You understand? And once the follicle moving more than 26 millimeter, as a matter of fact, 23 millimeter, it is expected to rupture. All right? The rupture that the ovary body will tear and the thing will come out. But in a situation where the thing persists, if it continue like that after 35 millimeter, it becomes a pathologic cyst at that point. Yes, but sometimes it may disappear. But that one is something that you need to be properly followed up and see. Is it talking for yourself now? We're talking about infertility again.
Yeah, I'm not sex selection. I wanted to know.
Are you selecting on this one or you are selecting the next one?
She's selecting this one according to the Billy's method. She's trying to.
You want to select this one?
Yeah. No, she's expecting.
Okay. Okay. You know, honestly, having followed up that engagement over the years, it works, but it is not something guaranteed. You understand? Because it is actually defined by the fact that if you meet a woman on the day of ovulation, that the male sperm cells being faster could be able to reach there before the female sperm cells. All right? But on the other hand, sometimes ovulation behaves like a Eric airline that will tell you that I'm taking off by 12. So all those small factors are there, and you may think, say, the day, okay, now making us start running. I was once told, my dad used to tell us that time why people start dying. That God say, whosoever that will reach to God to go and give message, that definitely that one. They know that tortoise is slow and the dog is faster. So they wrote it that dog go and give to God that nobody should die. The other one they give to tortoise, say somebody should die. Only for dog to waka or can't reach, can't see one woman where they pound this and they can't relax there. They chop only for tortoise to pass. Go deliver it to God. So that's why me and you did die. You can imagine what happened. So, on that accord, sometimes this very sperm, if you see the way they move, find out sometimes they could be very crazy. Some you may send on an errand, it goes somewhere they dream tumble. So, if you look at this now, let me see. Okay, let me use this one. Okay, if you look at this, is the sperm actually allowed to go into the this monitored from it's monitored from the vagina. A lot of them that this is service, some will enter the service now. But if you look at this, you see, all these people are joining to go and meet the egg in the fan. You see some dung they are just the gist. Now people they send for mission. So they hear the gist, some other one now will pass. So you can imagine as many as 300 million sperm this man released. Check out the few that got in there. So you find out that one idiot may be the one they sent first. Just sit here. So that is the inconsistency of that. So we have been able to deploy, if not because of COVID, we're having here a PGD, cell selection that can give you 100%. This is called pre-implantation genetic diagnosis. So the company that I signed the accord with in Thailand, because of this, so any moment from now, it will have that 100% assurance, cell selection, and all those chromosomal abnormalities will be taken off to ensure that the baby that will be delivered is good. When I know the clap, all right, thank you very, very much. I will finally tell you this. Please, you do me a favor and share it with somebody. Yeah. We have a vision that by the year 2025, Nigerian life expectancy will move from this 54 years to 70 years. Many people thought that I'm joking. How possible could that be? But it's gonna be a miracle that will be performed in the land of the living. By the next 3 months, September actually we're working on, we're going to deliver this very app they developed in the United States. And this very app will be available for everyone. It's called DrSaveAlife. This very app. This very app will be able, you can use it to consult for yourself. You can use it to consult for yourself. You can use it for on behalf of. So you don't need to be in position to.
When did it start?
So he'll be talking to you. It will come in Hausa language, Igbo, Yoruba, Broken, and also this. It will even that has to do with your baby. All of the things. If you have an emergency, any emergency you have where there is no doctor, just open it up, and then we show you what to do. Also, animated form of that. For your baby, it will show you what to do when you have a baby suffering this, and also being in position to know what you must do before this very baby goes. This will be delivered to us, and I'm going to sow it as a seed, free of charge to all Nigerians. The other African countries will pay 50%. Europe and America will pay the full amount. And then we have been able to deploy the first cat lab. This very equipment is the first digital cat lab in the whole of Nigeria. It's 900 million naira. This engagement, we did it with CBN and Access Bank together. It is right there in this area, in the third floor. For all these heart emergencies, heart attack, all those heart failure, all those things that people, unfortunately, where this is not available, forget it, people will just be dying anyhow. A man that had the three vessels of the heart got blocked. They did it in Turkish hospital in Abuja. So they were to fly the man out on to go and do coronary bypass surgery. They just got to know about us and brought that man. Within 1 hour 45 minutes, the three arteries were fixed on what is called angioplasty. That same man that day, the same day, was moving this floor, climbing the staircase, a man that couldn't be in position to walk. So we are very hopeful and very optimistic. Very soon, we are putting up a structure here. That's why you see this new development. And it will come in a format that you may begin to see some air ambulances landing on top of here. Wow. So good news I have for everybody. There is something that happened here a couple of days ago. That should be on a Thursday. On a Thursday, this particular woman, sometimes I've seen that God can use anything to save somebody. There's a woman who had to do what is called a peripheral angiogram. The leg was swollen, so we trace the vessel that blocked, that caused that very swollen. So while we are doing it here, there's a particular injection. Listen to this and listen good. My friend, don't go far away. There's a particular injection that this very injection, if somebody has stroke or what is called pulmonary embolism, if that injection is given to that person within a space of 4.5 hours, that person will recover from stroke 100%. 100%. What kills most people you hear in the house or majorly even in the hospital is the one that what is called pulmonary embolism. Look at this. You see this very curve here? There's what is called deep venous thrombosis. This very place, you get this place swollen and very painful. It's a very dangerous sickness. If this thing throws a bubble of blood into the blood and it gets to the pulmonary artery, that person can die. One woman, after we have that very injection for this woman, we did this. We didn't use it for her again when we discovered that the block pulled out on the process, which is good for her. So that injection, we kept it. Only for one woman here became breathless. He had what is called pulmonary embolism. In our hospital system, anybody that has that problem will be dead, because you can only use what is called all these platelet aggregators, the one that prevent platelet aggregator, like all this clezine, all this clopidogrel and all the rest. But that very tissue plasminogen activator is the name of the drug. We just gave that injection for that woman as the oxygen was dropping. Instantly, the oxygen got to 100% at once. That woman is still up there. She would have died last week Friday when that incident happened. So at this very point in time, we are preparing this hospital for maximum emergency attention. Maximum emergency, that if it has to do with anything that has to do, is there any small thing that can be done to save the life of this person? And going for that extreme. A particular team is also coming in, a cardiac team that will be coming in to be part of the system. Train the other ones that will be trained. One of them, I'm also sending him to UK now. He will also go train and come back. I want to tell you, be very optimistic about this country. The future is good. Are you with me? Yes, sir. The future is good. Don't give up. God brought us here. I was offered the American green card, and I asked them, what am I using American passport to do? Nigeria, I'm here, and I'm here in Nigeria to solve the problem. Don't be analyst of the problem. This one. The reason why we are here, you know what? Nigeria is the richest country in the world because it is very rich in problem. It is very rich in problem, looking for who will solve it and become a billionaire. Do you get what I mean? Looking for who will solve it and become a billionaire. Don't run away from this country. We want to run to Canada. There are people in the US that are paying their house rent for their mortgage. I'm the one paying it. Otherwise, they will take them out to the street. So it's not as we thought. Are you with me? So be here. In this kind of liberty that we enjoy here, you don't know what is freedom. You know the difference between some prison in the United States is better than where some of us are living. Do you know? But freedom, you cannot buy it with anything. Over there, you see some of bondage of life. But yes, real bondage. If I just, because of the mental this, and I had a program in Los Angeles, and I told them in the conference, and I told them there is no racism in America. Oh, goodness me. They almost swallowed me raw. I said, Dr. Richard, you don't know. No. I said, quiet. See, it's your brain that does not know what he's talking about. The reason is, and I told them, if America is a racist country, Obama wouldn't have been president twice. In 2 tenures, he wouldn't have been. It is a cultural ideology that does not have any scientific proof. Here now, we just a lot. Is it not true? I can just tell you, look at your head as big as hammer. We will laugh. No be so? And now, another person, because of color difference, will tell you big head. He said, no, he's using racism on me. Nonsense. Listen to me. There is no racism in success. I have staff in US, whites. They call me boss. There's no racism. If you are a player and you score goal, you are black and you score goal. Goal! Before you see a white lady will hug you, nobody so, hey! Because success does not have discrimination. Did you hear me? It's when this kind of inferiority complex, they feed it into all the young boys and blacks. After I finish talking with them, most of them, it's like scale falling off their eyes. face challenges, not when you see somebody first. You feel that, oh, because it's a white, I'm already a disadvantage. That's why many of them in the United States are living like in chain. They can't go beyond a particular belt. As I came into America and I'm still doing all these things I'm doing. I'm there, yes, I'm in Nigeria. Nigeria is an insecure place. Nigeria is this one. Yes, I will still get money from here to pay for you. I will leave you people when they make una come outside. Some of them are living on stimulus of the COVID this thing. So I beg, if you are planning to travel, look at the problem, one problem in Nigeria, solve it. If you solve it, you will make money. How rich do you think I will become? Not now. Don't look at me now and say, this one now. What you see here now, poultry house. Yeah, it's a poultry house. But the issue is that because I've set my eyes to the problem and I found solution. So that's what I want to encourage you. Encourage your husband. When your husband, don't have a husband that will sit in the house. You say you no go work since they sacked me 10 years ago. Start with what you are. When I was in Dube, you see Dube, I lived in Dube before. Yeah, I lived in Dube in 2000 and I packed out of Dube. Yes, I packed out of Dube in 2009. Whatever you see all over the world happened in the space of 10 years. In the space of 10 years. But while I was living in Dube and working in teaching hospital, I printed my books. Those days, I took 1 million naira from Union Bank then. So I used my salary. I printed books. Some of my boys sold the books and ran away with the money. So I crashed to start all over again. So I wasn't getting salary again from teaching hospital. I have 405. I use that vehicle when I come out from teaching hospital, from Rumukoro. I will pick passengers to Rumola. From Rumola, we pick them to Lagos bus stop. If I run on 2 times, I will come back home. One of the days, I carried one guy from UPTH, being a staff for UPTH now. He now saw me after that I rushed. Now my car, he could enter, the front. Begin gist me. Say, oh, Dr. Cohen, are you? I say, not me. There's no issue about that. And he was just gisting me. And I came to UTC Junction and stop. As he stopped, now I want to walk out to greet me. I said, my brother, no be walk out. I said, come and pay me my money. Pay me my money because he will be the one that they later went to UPTH and say, do you know that Dr. Koye and I, the director, is immaterial. It is a moment of then. And I don't have to beg you to pay my bills, to buy fuel. I face the situation based on the way I found it then. So that I was driving, using my vehicle to drive taxi, it's immaterial. Today I'm buying to give people. Somebody has come to my office. I know there's a problem between the husband and the wife. And what is the problem? Because the man is doing nothing. And I say, what do you do? He said, I'm doing Uber, but the person collect my money. How much is it? Go and find a car, we pay for you. That's how I restored that very family back again. The man is using Uber now to go and get into his family. What am I trying to say? The summary of this engagement is that begin to see life from another perspective. Why am I in this situation? God sent me here for a purpose. If he want make I be American, he go born me there. One man said that if it truly that the earth will rotate, why is he still in Nigeria? But I don't suppose rotate. Thank you very much. I really appreciate you people, please. Thank you and thank you and thank you. Please come and...
When you were talking about extreme and moderate challenges in pregnancy, you said from 12 weeks to the date of delivery, there's a particular medication the person should be used
if the person has suffered pre-eclampsia before.
Yes, and you talked about moderate and